A massive analysis of the existing human studies concluded that there are 19 strong recommendations we can use to lower our dementia risk. And as we go through the recommendations, make sure that you're ticking off in your mind that you're doing each one. This paper was published in November 2020, and it included 243 observational studies and 153 randomized controlled trials. They looked at 134 different factors that may influence dementia, and of that there were 19 that had strong evidence for influencing dementia rates. And the first recommendation is cognitive activity. We need to make sure that we're stimulating our brain, that we're doing difficult problems. And it's the classic case of use it or lose it. We want to always be learning new things, pushing the boundaries, acquiring new skills. Number 2 on the list is to aim for low levels of blood homocysteine. There is a strong correlation that people with high levels of homocysteine in their blood seem to have higher rates of dementia, and personally I use a supplement called TMG or trimethylglycine to lower my homocysteine levels. Number 3, and this might sound a bit strange, but we want to make sure that we don't become too skinny as we get older. So one of the common things that happens with people over the age of 65 is that they lose muscle mass. So we need to make sure that we're eating a diet that's high in protein as well as regularly exercising. We need to stop that weight decline as we age. Next is depression. Depression strongly correlates with increased rates of dementia. So we need to make sure that we're looking after our mental health, that we've still got an active social life, that we're still doing hobbies that bring us joy. And one of the strategies that I often mention to my patients is meditation, which leads to number 5 on the list. We want to make sure that we're managing our stress. There are some forms of stress that are fantastic for the body, so I'm thinking here of exercise, but other forms of stress such as financial stress, job stress, relationship stress, all of that is actually really bad for the brain and for the body. And again, meditation is a fantastic way to help with stress. Number 6 is diabetes. People that suffer from type 2 diabetes, they've got higher rates of developing dementia. We need to make sure that we're eating a diet that's low in sugar and high in fiber, as well as regular exercise. Head trauma is number 7, so we need to make sure that we avoid activities that rattle the brain. Number 8 is high blood pressure. Now many people don't get symptoms of high blood pressure, and they only notice something if it goes pop. So I'm thinking here of heart attacks and strokes. So we need to make sure that we're regularly checking our blood pressure, and ideally we want it below 130. Classic things that make blood pressure go up is a high salt diet, alcohol, and lack of exercise. But for patients that I see in the clinic who are already practicing healthy life habits, if they've still got a high blood pressure, then I start blood pressure medications. But that does lead us on to number 9, which is orthostatic hypotension or low blood pressure when standing up. This is a particular concern for older patients, so often the blood pressure response, it's blunted as we get older. So when people stand up, sometimes their blood pressure goes too low and they feel lightheaded or faint. So when I see patients in the clinic, I need to make sure that their blood pressure isn't running too low, particularly as they get older. Number 10 is education, particularly in childhood. Now none of us will be able to influence that for ourselves, but for our children or grandchildren, it's vital that we offer them as much education as we can. Number 11 is obesity in midlife. For people below the age of 65, we absolutely need to make sure that we aren't obese, that we've got a healthy weight, and we do this through a great diet and regular exercise. Now for some people with weight loss, it's very difficult. Now though, we've got weight loss medications such as semaglutide. Semaglutide is a medication that was primarily designed for type 2 diabetics, but because of how it works, it results in significant weight loss. So this is a class of medication called GLP-1 receptor agonists. This is a class of medication that I'm often prescribing to my patients in the clinic to help them with their weight loss journey, and we're seeing epic results. But that does bring me on to number 12 on the list, which is weight loss in later life. So this is something that we need to avoid, and we've already mentioned how we don't want to become too skinny as we get older. We need to make sure that we're holding on to our muscle strength and not losing weight. Number 13 is physical exercise. So this is both resistance training and cardiovascular training. So with resistance training, we need to make sure that we're lifting heavy weights through a correct technique. We want to make sure that we're progressively overloading our muscles, stimulating to them that they need to become stronger. And with cardiovascular fitness, we need to make sure that our heart function is optimal. Number 14 is smoking, and I'm sure I don't need to mention this to any of you, but smoking is terrible for our blood vessels as well as our brain health. Number 15 is high quality sleep. So as we sleep, we're flushing away many of the toxins that our brain builds up during the day. So it's crucial that we give our brain that time to recover. So we want to make sure that we're getting at least 7 hours of sleep per night. And it's crucial that those hours measures are quality sleep. So one of the things that I encourage my patients to do is to check for sleep apnea. So we do this in the clinic either through a sleep study, or if they share a bed with a partner, we make sure that that partner is checking for things like snoring or stopping breathing. That is what sleep apnea is overnight. Next on the list is heart health. So if we're looking after the blood vessels around our heart, we're also looking after the blood vessels in our brain. Now, one of the best ways to look after the blood vessels is a great diet and regular exercise. But I also check the cholesterol levels of my patients, because if they've got high LDL cholesterol or ApoB, that's when we have a discussion around statins. Now, online, there is a big anti-statin movement, which is unfortunate because the initial concerns around statins are based on outdated data. We've actually got some interesting research suggesting that statin therapy may actually reduce the rates of cognitive decline. There are also other medications such as ezetimibe or PCSK9 inhibitors that we consider in the clinic. The 17th factor that the study identified is frailty. So we have touched on this already. We need to make sure that as we age, we're holding on to our muscle strength, and we do this through a great diet that's high in protein, as well as resistance exercise. Number 18 is atrial fibrillation. So this is where the atrium, or the top part of the heart, it goes into a spasm or fibrillation. That puts patients at a higher chance of developing clots in the heart, which are then pushed out into the brain, causing strokes. And we can reduce the rates of atrial fibrillation again through a great diet, regular exercise, and controlling blood pressure. We're aiming for a systolic blood pressure below 130. The final factor that the study identified is vitamin C. So we need to make sure that we're getting enough vitamin C from our diet. So lots of fruit and vegetables. As you can see from that list, there are many things that all of us should be doing to significantly reduce our chance of developing dementia, and primarily it's lifestyle. So a great diet, regular exercise, high quality sleep, meditation, and the occasional supplement. And the supplement here that I'm thinking of is TMG, or trimethylglycine. Now this one, it does need some further research to actually see if trimethylglycine can lower the rates of dementia, but it's an interesting area of research. And to learn about the optimal protein intake, check out this next video here. A big thank you to all of the patrons and channel members, as well as DoNotAge.org for their $10,000 donation to my rapamycin clinical study. They are a health research organization, and to benefit from their ingredients as well as a 10% discount code, check out the pinned comment.